Hello and good evening. First off, I would like to thank Dana, our plaintiff, and Valerie, the defendant. They both had very valid points for this case. In this scenario, the plaintiff stated that her personal information, including her social security number, her age, her address, her phone number, past appointment information, and past provider information, including psychiatric appointments and etc., were shared with employees, including the members of the operating schedule team, or OR team, and her personal supervisor, who was not part of the OR team. And due to this information being shared, the plaintiff felt that a violation of her privacy had taken place and now is suing Ashford Hospital because of that violation. According to the Health Insurance Portability and Accountability Act, or HIPAA, there was no violation of privacy. Therefore, I am ruling in favor of the dependent. As all employees who saw this information either needed to see the information to perform their tasks for work or had exceptions to privacy due to their rank at work. In this situation, the information that was shared with these employees was not information that they would not receive for any patient that had scheduling and billing needs. The plaintiff, as an employee, was not being singled out as an individual that was having information shared that was not normal information for these individuals to see on a daily basis. And so, as long as those employees were not sharing that information with people that did not have access to that information to perform their tasks at work, no HIPAA violation took place. And as far as her personal supervisor seeing the information, he is or she is in a senior administrative position. And according to HIPAA laws, when it comes to employees, senior administrators have exceptions so that they are able to see information that other employees do not. So again, as long as that senior administrator was not sharing that information with employees or other people that do not have access to that information, then no violation has taken place. Confidentiality has stayed the same, and no violation has happened. And the reason that this information is included in patient records is for billing purposes, and also so that patients can receive the very best care possible by providers, and providers need to see this information to provide that care. So no HIPAA violation was performed in this scenario. The patient stated that she was treated differently when she returned to work after receiving or having her procedure done, and therefore it made it difficult for her to perform her tasks at work. This scenario, although unfortunate, does not have anything to do with a HIPAA violation. In circumstances such as these, it may be something that might need to be taken up with the HR department, the Human Resources Department, because if these employees are treating her differently, then they have made her aware that not only did they see the information, that they remembered the information, and that they are using that information in such a way as to it has changed their perspective of her. And so in such cases, it would be a work issue because you are being treated differently by employees. However, that does not mean that your privacy was violated. because in these scenarios, patient information like this is seen all the time. And as long as those patients are not treated differently, then no violation has taken place. So, again, ruling in favor of the defendant. Thank you very much for your time, and I look forward to seeing what the other jurors' perspectives are. Thank you.